another episode of MedTalk. My name is Dr. Tushar Patel, and we have a very special guest, Dr. Sudhakar Jonnalagadda, with us today, who is a president of the American Association of Physicians of Indian Origin, AAPI or API, which is the largest and one of the most powerful ethnic physician organizations in the United States, and represents the interest of more than 50,000 physicians and about 15,000 medical students and residents of Indian heritage in this country. He is a board-certified gastroenterologist and transplant hepatologist in practice in Georgia. He was previously a president of medical staff at CR Medical Center and also very active in Medical Association of Georgia as a director. Welcome, Dr. Jonnalagadda, to MedTalk.
Thank you, Dr. Tushar Patel, and a pleasure having me.
So you hold a position in a very influential and powerful organization in the country. You are the 37th president of the API. What can you tell our viewers? What is API and how long is API in existence? And what are the goals and objectives of your organization currently?
Very good question, Dr. Tushar Patel. API established almost 40 years ago in the state of Michigan by a group of Indian physicians to fight against discrimination. That's why it evaluated, because those days Indian physicians are very low in volume. So then it evaluated from there into one of the strongest. It is the second largest physician organization in the United States after American Medical Association. Currently, we are holding about more than 100,000 physicians that include residents and fellows and practicing physicians, academicians also. It's a very strong, powerful organization. If you look at the numbers of physicians in teaching faculties and in practice and entrepreneurs. And I'm very fortunate to sworn as the 37th president of API. And my goal is this year, to increase the membership for younger physicians, because they are the one actually the lifeline for the organization, and we're trying to encourage more younger physicians, and we're trying to bring more membership benefits. My most goal is, clinical observership program we are offering through AAPI. What it does is most of the doctors, medical students, before come to residency, they need some experience in US, how to take care of the patient, bedside mannerisms, and actually, in fact, language also very important for them. So through this clinical observership program, the children will be able to get some understanding, how you practice medicine in this country. And we are offering first time during my presidency to medical students who are going for residencies. It really helps the foreign medical graduates, international medical graduates from the Caribbean or coming from India. And number one. Number two, first time you're offering membership benefit to the members, 20 hours free CME credits to our members, so that it helps for them to learn, update everything. You all know that for the last 4 or 5 months, we're working very hard to update all the knowledge about COVID to our members. And this is a part of the thing we're going to continue. And also we divide into two parts, CME and non-CME CMEs, and 20 hours free CMEs for the members, and non-CMEs, different kind of subjects we're going to discuss. And I'm planning to see you can able to stimulate the API pack, which is very, very important for the physicians, because a lot of people are asking API should have a pack, and which we are going to plan to, we have a pack, but we are going to energize the pack, because a lot of physicians would like to join that. And most important thing, we have two important things always, every year we'll do. One is the Global Healthcare Summit. And this year we are planning to do in Visakhapatnam. And we plan to launch liver disease awareness program in India. And I always spoke to the chief, since I'm from the state of Andhra Pradesh, usually the present state, we do the Global Healthcare Summit. And it happened to be a new state of Andhra Pradesh. We're going to do it in Visakhapatnam, which is a nice oceanfront city. And we're going to launch the liver disease awareness program. We're going to work with the Union Minister, Dr. Harshvardhan, and also the Chief Minister of Andhra Pradesh, Health Minister, and Telangana states. And you all know that liver diseases are very predominant in India, particularly hepatitis B, and a lot of people not aware of the disease and treatment also. and a lot of people are dying because of not knowing the disease pathophysiology and how the symptoms are. And we're going to try to educate, and also we're going to do the obesity is very important. AAPI working very hard for the anti-obesity program, and every year we do a lot of obesity walk actually in the cities where you do the Global Healthcare Summit, and we're going to do that. And we do, and also this year, hopefully, if everything opens up in the country, we plan to do our convention in Orlando in July 4th weekend. And a lot of physicians really want to get out and have a hug with each other because of the thing going on right now with the lockdown situations and social distance. Hopefully, by the time in December we'll get a vaccine. Hopefully, that helps us to go out and enjoy the people and friendship relation.
Wonderful. Thank you so much for that wonderful introduction about AAPI, your goals and your vision. So, Dr. AAPI is a national organization. Do you have any local chapters?
Yes, there are 110 local chapters in the United States. Okay, where I came from, Georgia, we have a local chapter called Georgia Association of Physicians from Indian Heritage. Very vibrant chapter, and they work very hard. And in fact, they during the COVID when it started, we collect the money and give the Prime Minister Fund. Actually, they donate some money to the Prime Minister Fund, and also they donate the food to the needy people, for in Georgia. And likewise, all the state chapters in the United States, AAPI local chapter, they work very hard during the COVID time. And in fact, AAPI donated more than $100,000 to the local chapter so they can able to utilize that money to help the needy people, particularly nursing homes. And also we gave the PPE, masks, gloves, and shields, everything we donated free to the nursing homes, some areas in Washington, D.C., and other areas, and Maryland. And we work very hard, to protect our physicians and try to protect our community with this. Yeah.
So, how does the AAPI represents physicians in this country? You said you have a national organization and you have local chapters, so they have a choice of joining both ways, right? Can they join national as well as local?
Yes. Usually, we try to promote dual membership, okay, local chapter along with AAPI, national AAPI, and it's going to work out well because our membership is not very expensive. It's not very expensive, so it's like our AAPI membership, life membership is going to have a cup of decent dinner, that costs AAPI membership actually. And we try to promote a dual membership between local chapter, national AAPI, and that's why we don't need to do too many membership. One check will get two membership.
Wonderful.
That's what I plan to do.
Very good. So for almost 5 decades, Indian physicians have made significant contributions to healthcare in this country by practicing in inner cities, rural areas, urban areas, remote areas, and don't forget the government service or the academic institutions and underprivileged population. How do you protect our physicians' rights and discriminations against the physicians of Indian origin? What is your vision and goal?
Yeah, good question. Actually, we have a very vibrant standing committee for ethics and grievance committee. If any physician of Indian origin, if you have a problem with the hospital or any issues, if you can report to the AAPI, our team will work on that actually. And anything, do not hesitate. We're here to help our members, and if you can give a buzz or send a letter or email, we're ready to help you in any aspect. We're there for you.
Wonderful. So now let's move on to the question of the medical students. So close to 15% of medical students entering the U.S. medical schools are of Indian origin. Do you have any vision or guidance or mentoring programs for them to bring them in a leadership role at an AAPI level, on a national level or a state level?
Sure.
Do you have any kind of programs?
Absolutely. Our younger physician section, YPS and medical students, they have a very active mentorship program. And any student who want to get any guidelines, okay, from them, they're happy to help. I think if you log into the web, there is a mentorship program icon is there. They click in, they get in, and they'll get help right away. So this is all done by the second generation young physicians. They are one going to do the mentorship.
Very
They
good,
do.
very good.
They,
So, if I'm a physician, I'm practicing, everything is going well for me. Why should I join a national API? Can you discuss some of the benefits? I know you already mentioned some of the benefits, but if a younger physician practicing and he's not interested in anything else, he's just happy with his practice and go home and enjoy life.
right,
But
right.
what can we do for those individuals, those physicians? Do you have any platform which creates some additional benefits to those
Sure,
young physicians?
sure. The RP will give a broad platform for younger physicians for advocacy and networking. And because the most important thing, we need to know the fellow physicians, who in the country,
Yes.
and RP is the best platform for networking. And I understand, because, in the early part of the practice, you are busy with your our office practice and hospital practice. After some time, you really need to have some kind of platform where you can communicate with the rest of the country, with the physician. This is the best thing ever happened being a member of RP. They can network and pretty good.
Yes. Yes, so networking is a very, very important tool.
Absolutely. Yeah, yeah.
Yes, definitely. So let me ask you a question, Doctor. Did API get involved in COVID-19 response or providing guidance or support in response to public health crisis with current pandemic in last 3-4 months?
Big time, actually. I can say big time. Actually, RP was very proactive, in the beginning of the pandemic, and we educated physicians here in the United States through the webinars. We did about 40 to 50 webinars to educate our physicians, and also in India, and British, Australia. We did a platform for all these physicians also, and we not only the treatment aspect, okay, the prevention aspect, all we actually did the educational aspect to all the physicians in the country, India, everywhere, and RP, the first organization, in fact, promoted plasma therapy. Plasma, I'm sure you all know Dr. Tushar.
Yes, yes.
Plasma therapy, we are the one first promoted to the Red Cross and local banks. We wrote a letter to the President Trump, and also all the governors, senators, and congressmen to tell them what is the importance of plasma therapy in the critically ill patients of the COVID. And really work hard. It really went well, actually. They recognize that, actually. Some hospitals we actually went and educate them, actually. See, we need this. So, for example, Connecticut, in my hospital is a small community hospital. I bugged my the CEO. We need to have this plasma in your office, in hospital, okay? And she got it. So we did very work on that, and also, of course, the treatment. Also, we work very hard to educate the prednisone, steroids.
Yeah.
Is a new therapy we are working on that. We educate the physicians. Very important to save them not to go to hospital. Steroid. We did a lot of seminars for that, and other thing, we really work very hard. We actually treated 100 hospitals, nurses actually. We gave lunch for them, appreciate the frontline workers, we appreciate their efforts, So we bought lunches for all those people, and we did a very active role during COVID, very, very active. Our members, I'm so fortunate to be part of this organization.
Wonderful. Kudos to all RP members and the board, and congratulations. So let's talk about little bit about some power and strength and unity in RP. So what is RP going to get the physicians' voice and concerns heard by the lawmakers at a national level as well as the state and local level?
Yeah.
Even the Congress, Senate, and the White House. Do we have the voice for the physicians heard at that level?
Absolutely. We have a special standing committee called legislative committee, and we have members, and we're very active. We meet the lawmakers twice a year. We go to the Capitol, and we meet with these people in the Capitol and discuss our issues, and we act. For example, if you take H1 visas right now, for the physicians are waiting on about 400,000, about 400,000, I think, something 40,000, 400,000 physicians are waiting on for the H1 visas. And in fact, RP took a very active role, and one of our Dr. Sampath Sivangi is our standing committee chair. he is involved in helping these bills to go through to the Senate and Congress. One thing, and also we do a lot of interaction with lawmakers so that promote what we need for the physicians in future, like a Medicare reforms, all kind of stuff. And this year I'm going to work on with lawmakers, see if we can able to help to increase the residency slots, which is very important for our physicians. So this is my prime goal this year. Try to increase the residency slots. That's what we're going to work on when we go to the capital. Yeah.
Very, very good. So you recently appointed as AAPI National President, and your leadership is very, very vital to your organization. What is your vision? I know you mentioned already a few things, but what is your biggest focus to bring AAPI to a next or a higher level?
Financial stability is very important. Okay, this is where any organization will survive. To have, if you don't have it's hard to survive without financial stability.
Yes.
That's my main goal, to see if we can able to do some kind of fundraising activities, because last year our convention canceled because of COVID. Okay, so API is kind of depending on conventional profit. Okay, to get into to survive. So we're trying to do the fundraising this year, so you can able to strengthen the organization financially, and most important, united. We want to make API united.
Yes.
That's very important. That's my main motto.
Very good. So lastly, any departing comments or take-home message for our viewers, and especially for medical community physicians who are already members of AAPI, but more importantly, those physicians who are not members of AAPI, or they are in the remote area and they don't have enough communication about AAPI. What is your departing comments?
I always preach, this is one of the great organization to involve, so that if anything, see, that's support the organization. This is my motto: support the organization will support you. So that's my motto, and it's a great organization for networking, advocacy, and if they have any issues, with legal issues with the hospital, everything, we have ethics grievance committee for the members, and we're very active in it and help the people, our members. And I think my request, be member of API and support the API. API will support you, and that's my main motto.
Wonderful. That's a wonderful message. So thank you so much, Dr. Sudhakar Jonnalagadda, for your time to come to MedTalk to provide some valuable information about AAPI, your vision, and how you'll be leading your team during your term. I wish you all the best, and also want to congratulate you for your new role. And I wish you all the best in service to your community as a provider and leader of AAPI, and also staying healthy as well. So congratulations, kudos to you and your team. Keep doing the wonderful job for the physicians of Indian origin, and represent all of us in the country. Thank you so much.
Thank you, Dr. Tushar Patel. Thanks for having me. Thank you.
Thank you.